Personalized health is trending right now. And in this video, I want to discuss 4 areas that I think are really important to make personalized health a reality and make it ethical and available to everyone. So what is personalized health and nutrition, and why is it trending right now? I think there are a number of key developments that have happened over the last decade, I would say, that really make this quite a very important time in the industry and even in history. I've been in nutrition for over 25 years now, and this year seems to be a year that has really been radical. This is a year where I've really seen a dramatic change in how different industries converge, and also how kind of different areas and industries need to play together to be able to serve the customer of today and tomorrow. So what we are seeing right now is this convergence of industries such as pharma and wellness, healthcare, nutrition and technology, all coming together in different ways, but really driving the future of health and the future of food forward. Now, this is really important because when we think about nutrition and how that plays out into the marketplace, it's really around prevention on the one hand, so maybe individuals who don't have any kind of symptoms but want to prevent diseases or conditions later down the line. And then on the other hand, we have this food as medicine, which is where food is really seen as a key lever to optimal health, to manage health, but also to manage conditions. And so as consumers become more and more interested in their health, more and more food plays an important role, food and nutrition, as well as exercise, stress, sleep, social connections, for example. These are levers that really are the drivers in terms of achieving optimal health. Now, what we are seeing in the industries, of course, is that some of these very big companies that, for example, were only really around wearable technologies are now pivoting to health span, longevity, and personalized nutrition. And so this is really important because nutrition is now not seen as something on the fringes. It's now seen as a core component of any solution because we eat all the time. We eat every day, we need it to sustain our health, and it is a significant contributor to, of course, our health span and healthy aging. And therefore, nutrition is becoming more and more important, and some of these very big players are starting to realize that consumers don't only want kind of an understanding of what to eat, they also want to know what is in their food, which means transparency has become a key component of that as well. So when we think about the old world, we think about diagnostics, going to your doctor, getting the results, or waiting for results, or going for your consultations, but also thinking about the focus on sick care, where you have to be sick to be able to or feel something, have a symptom, to go to your doctor, ask for advice, or even go to your dietitian or your nutritionist to then get guidance in terms of what to eat or what to do. What we also have seen in the old world is kind of all the silo data. So you have medical notes, then you have your food intake, your nutrition notes from your nutrition expert. There's now wearable data. There's shopping behavior in terms of what you buy, and then of course there's your lifestyle data. How often you eat out, how often you exercise, how much you drink, if you smoke, all these different things. And so all this data was sitting really in kind of siloed pockets, but now that's all coming together to provide really a comprehensive picture of the individual, and that is then driving this personalization in terms of what consumers should be doing and in order to achieve their health goals. But in the new world, things are completely changing or shifting, I would say. It's not a radical change, we are seeing a shift. And of course, there are a lot of barriers and obstacles that are along that way. But if we think about it, there are more diagnostic tools that are at-home kits, for example, that are becoming more accessible, that are becoming more affordable. We're also seeing the shift towards a more consumer-focused solution. Many solutions, it's talk and still doing it the old way. But some companies are thinking about how do we really put the consumer at the center and build an ecosystem that really drives that lasting behavior change, that have the solutions that will actually work with their capability, with their budget, with their preferences, and with their goals. And so everything is becoming more consumer focused, but we're also seeing these rapid advances, of course, in terms of AI. And so when we have all the silo data, and then you leverage AI to then make sense of the data, and then provide, some kind of, you add machine learning with that, or help users to ask questions about their data using natural language processing. All of this enables a much better experience in terms of how you improve your health, how it's more personalized to you when you want the advice. And so AI is really opening up these opportunities to deliver on personalized health, which wasn't there really before. Then we also see in this new world, this focus on health span. So people, as I said, are more and more interested in their health. They are prioritizing their health. They are investing in their health. They are looking at kind of a more holistic way of improving their health, whether that's through sensors, through wearables, through food diaries, through seeing coaches, through getting, support. And this is really shifting the whole kind of personalized healthcare into more the prevention area. And of course, we are also seeing more focus in terms of behavior, because we know that there's a huge gap in terms of what users want to do, what they want to achieve, and what they then actually do. And so focusing in this new world on how do we help users, consumers, clients to adopt these healthy behaviors in the long term that are really, really sustainable, I think is really key in terms of this, future that we are moving into. Behavior change is not something on the fringes anymore, and what we are seeing that, of course, is becoming an integral part of these behavior change, or these personalized health solutions, so that these new habits actually stick. Not all companies are good at this, but we are only starting to realize this importance of not having this data overwhelm, but really providing the insights that users need to act on actually those recommendations. And of course, as I mentioned, this intersection of kind of tech, health, nutrition, society is all coming into play in terms of this new personalized health area, where the lines are increasingly blurred, and where the concept of kind of what health means, what health is, what nutrition is in context of health, is all really a new kind of dimension, I would say. And so what we are seeing is pharma is moving into prevention because of consumer push. Wellness companies need to be more scientific to prove their efficacy, and so they are becoming more scientific. And we are also seeing, of course, technology companies that are just wearables that provide data and insights, now moving into including nutrition as a key component as well. So there are massive changes happening all at the same time. And as I said, really, we see a lot of this massive shifts happening this year, which is fascinating to watch. And of course, when companies come to us, they think, well, at what point do they come? So what we hear from executives is they don't know where to start in terms of personalization. They don't know what kind of data they need to be able to deliver on personalization. And of course, they are doing things that they've always done in the same way, which means that having this consumer focused is really changing the internal, organizational dynamics. The culture needs to be different, and of course how things have always been done is now being challenged. On the consumer end, we know that consumers are sometimes lacking motivation. So unless you're on the prevention side, you're already highly motivated, you're already highly educated, you have high levels of self-efficacy, you are in control of your health. That's not the case for everybody. I would dare to say it's not the case for the majority of people. So people need help, they need guidance, there's a lot of misinformation online, and so they need support. And they also want to know where to start, what is relevant to them, what kind of solutions fit with their preferences and their goals and their budget. Because of course, many of these solutions based on consumer surveys are saying, well, these tools are very expensive, they are not really relevant to me, they don't help me to change my behavior based on my lifestyle and my context and my community. And so there are a lot of obstacles where consumers are interested in improving their health, but they want this to be done in a way that is important to them, in a way that is doable for them, and is a way that they can do it in small steps that can lead to this lasting behavior change. And so there are many obstacles to overcome in terms of how do we create these new solutions. And of course, for companies, this really means looking at exactly where they are in terms of their journey. So are you looking at understanding the market? Do you have a good understanding of the consumer segment that you want to target? And so you need to really have a good understanding of where does your solution fit into this spectrum from prevention all the way to food as medicine or personalized kind of medical nutrition side. And so it's really important to understand that, but it's also important to understand what kind of data do you need to actually deliver on personalization. So that could be lifestyle data, it could be wearable data, it could be surveys, it could be sensor data. There's so many different data points that you can use to actually personalize, but it's not necessary to collect everything to deliver on personalization based on the solution that you actually have. So that's really important. And of course, getting a very, very good understanding of what it is the consumer needs or your client needs is incredibly important. And of course, if you are tailoring your solutions, it's then important to understand how does your solution, play a role in the daily life of that individual. And so for that, having mixed methods data or conducting mixed methods research is incredibly important, because people are not always going to, maybe provide very accurate answers on a survey, and having that qualitative data gives you therefore deeper perspective into the attitudes, the beliefs, the values, the behaviors of that individual, in order for you to then tailor the solution much better for the individual, because that will then map out or determine your roadmap. Should you partner? Should you buy? Should you even go in that direction? Because based on what consumers want to achieve their health. So there are many things to think about there. And of course, it's then important to think about how are you then going to position your solution. So when you know where you are on the spectrum between prevention and medical nutrition, what do consumers actually do? How do they solve their problems right now? What are the alternatives? Also, then what are the deeper values, beliefs, and perspectives consumers or users hold in order for you to personalize, and how do you position your product or solutions within that understanding? And so those are really very important key points. So if you think about companies like Whoop, it's a wearable that have now pivoted into providing personalized meal plans and recipes and coaching, and also MyFitnessPal, for example. I mean, it's one of the most popular products at the moment. When you think about food, it's not just about food tracking anymore, and getting educated about what's inside your food, but it's really providing an insight into how does that food, how does what you take in then impact your health in the longer term. And so that the connection between food and health and the technology, objective insights that can be driven by AI, for example, that is really the future of personalized health and how we connect food with health and help consumers in an informed way to then, manage or improve their health or manage their condition. So there's so many aspects to think about that. We know that in terms of the market, it's Gen Z and millennials that are really driving this change, but I wouldn't say that that excludes older generation who perhaps already have symptoms or biomarkers that might be slightly off. And so there's really an interest in, making sure that things don't get worse. And that really we have the right messages for the right target group depending on where they are in their journey, but also where the solution is positioned along the spectrum. So why, again, is personalized health trending now? Well, it's really this convergence of different industries coming together with heightened consumer interest in personalized health and personalized nutrition. And of course, we're having these blurring lines that really make changing your daily behaviors to benefit your health a lot easier than it ever has been before. There are a lot of questions about ethics, about data quality that we still need to talk about in future videos. But right now, the 4 components that you need to really drive and play in this personalized health area is quality data. You need to have proof of efficacy. You need to be able to leverage technologies such as AI, and of course, you need to be able to provide support and the kind of solutions that help to nudge individuals towards lasting and sustainable behavior change. Thank you. I hope you enjoyed that. More videos to come.